So we're ready for the big day with the surgery coming up?
Well, I think we're getting ready.
Okay.
I'm a little nervous, but I think I'm ready. Just the pain, I'm ready to have that.
Sure. That's normally what I hear at this point is you've dealt with the pain long enough that it's time to do something about it. So,
Right.
I like to meet with you ahead of time so we can go over what to expect with the surgery. Okay, it's a big surgery, so lots of times there's questions that you want to ask, questions that I've been asked before that maybe I can key you in on what's to come, so you're not kind of left in the dark with this whole thing.
Okay.
So what I do is I kind of go over everything that's going to happen from the point of the surgery forward.
Okay.
Okay. I can tell you in general that the rehab portion of the surgery, what we do in physical therapy after you get out of the hospital lasts about 6 weeks. I have some folks that are done in 4, I have other folks that are done in 8, so I'm just going to tell you 6.
Okay.
You can shoot to be done in 4 and everybody will be happy.
That sounds great.
Okay. How are you doing at this point with mobility? Are you lacking any mobility in that knee? Is it starting to stiffen up on you a little bit?
Definitely. The longer I sit, the stiffer it gets. If
Okay.
I'm in one spot too long, definitely.
Stair climbing is getting difficult for you?
Very
that sort of thing.
difficult.
Okay. So what I also do at this appointment is I kind of take a look at your knee and find out how much you are restricted at this point. Okay. How much mobility you have going into the surgery. A lot of times it tells us how much you're going to have coming out of the surgery.
Sure.
So the more I have information ahead of time helps me so that I can then help you afterwards. Okay?
Sounds good.
Let's back up a little bit, okay? So let's pretend like you just had, the surgery a couple hours ago and you're just kind of waking up, okay?
Okay.
At this point, you're not having as much pain as you think, okay? Because a lot of times they'll do a nerve block up in your thigh, that kind of numbs the pain. That's a great thing because you wake up and you think it's not so bad.
Great.
I'll warn you that wears off. The second day, you're going to have a lot more pain than you had the first day.
Wow.
Okay, I tell you that ahead of time because you might not have known that. They might not have explained that to you as much when you went through the pre-operative appointment with the surgeon. So I tell you that so you don't come back in here and think something's wrong because you're having more pain the second and third day compared to the first. Okay. Things have progressed a lot faster now, so you're going to only stay in the hospital a couple days. You're going to be there the day of your surgery, the next day for sure, and then maybe a third day.
Okay.
Not always. So what that means is if you have your surgery Monday, which I believe yours is Monday, I will be seeing you again either Thursday or Friday back in my office.
Okay.
That's quick.
It is quick.
Okay. But the sooner we can get you moving, the better off you're going to be in the long run. Okay? You will have therapy in the hospital for that short time that you're there. They're going to come in the same day. They're going to explain to you how to use a walker a little bit. They're just going to get you up and get you moving. You're going to think they're crazy because they're coming in about 4 or 5 hours after surgery and asking you to stand up.
Yes. Wow.
Don't look at them like they're crazy, okay? Just go along with it. It's to your benefit. Again, the more you can get moving early on, the better your long-term outcomes are going to be. Okay? You'll do therapy with them a couple times before you're discharged to go home, okay? So I tell you to kind of set things up at home ahead of time. If there's things you're going to want conveniently located, a lot of times you'll have a favorite chair that you want to be in after this. We do want you to be able to elevate your leg up, okay? So that kind of thing, plan that out ahead of time. Kind of warn whoever you're going home with that they might need to help you a little bit, okay? We don't want you trying to fight through this whole thing by yourself. You need a little bit of help from those at home. Normally they are pretty good about that. Right?
Sure.
Okay. So anything like cell phone chargers, anything like that, keep it close by so you know where it is. You're not scrounging around for it. The other thing that I always do with you here is I show you the exercises that we're going to do after the surgery. Okay. I'm also going to show you a couple things based on what I see with your knee that you can do maybe before the surgery to help you limber this up a little bit, maybe get your muscles ready for what is about to happen. Okay. We are dealing with a lot of swelling after the surgery, so you may have more pain higher here. Okay. These muscles are big. They can hold a lot of swelling. So you want to make sure that we're getting these ready to go ahead of time. Okay? The more flexibility and strength you have prior to, the easier it's going to be for you to get walking sooner.
Yes.
Okay?
Okay.
Let me take a look at your knee. We'll move to the table. We'll check out a couple things there. Okay? Just so I can get a feel for the range of motion of the knee, and then I can also go from there into what to expect afterwards.
Okay. Great.
So one of the things I look at before the surgery is how much range of motion you have in this knee now, okay? I'm also going to take a measurement around it. That helps me monitor swelling afterwards, okay? So you don't have to do anything right now. You get to lay still. I'm going to move your leg a little bit. If you do get pain, just talk to me about that, okay?
Sure.
So we're just going to bring your knee up towards you a little bit. Thank you. Get a little stiff at this point.
Yeah, a little
Not too
bit.
much pain. Starts to get a little tighter
Right
as you
there.
go.
Oh, yeah.
A little bit tighter at that point. And then if we straighten this leg out, not too bad. So the good thing about this is you've still got some pretty good range of motion. That'll help you recover a little bit faster,
Oh,
okay? I will take some measurements here
Mhm.
just to make sure. That way we've got them documented for afterwards.
Mhm.
So what I'm gonna have you do is you're just gonna slide your heel back as far as you can on the table.
Okay.
Good. Thank you. And then you're gonna go all the way flat down for me. Okay. Do you get pain there a little bit?
I hear it popping.
Yeah, okay. So the extension piece of this is pretty good. Can you tighten these muscles down? Yeah, perfect. And then we're just gonna measure. So, pretty good. Again, measure some swelling, so I'll just take a measurement around. You can relax your leg, just a bit. There you go, perfect. Excellent. Okay. The other part of this is we'll talk about some exercises you can do ahead of time. I'll first show you the first few things that they do with you in the hospital. Right now they'll seem very easy. If I put an incision here, add some swelling to your leg, maybe not so easy. Okay? The first thing I always have you do in the hospital is try to tighten this muscle right here. You just did it a minute ago. What you're gonna do is pretend like you're pushing your knee down into the table. Feel this tighten up a little bit? Right now, pretty easy for you.
Sure.
Add some swelling. Those muscles don't like to work as much. A little bit more difficult for you.
Okay. How big of an incision am I going to have?
It depends on what the surgeon sees while he's in there. Okay? Most of the time you're looking at a 5 or 6 inch incision on the front of your knee. Okay? Got to have enough room to visualize everything there and to get the new piece in. So very dependent on the size of you. You have a thinner leg, so you should be able to get away with a little bit smaller than some others.
Okay.
So hopefully you'll be able to wear shorts again, right?
Oh, hopefully.
Okay. The other thing we have you do is just to slide this heel along the table, okay? You can imagine if we added a lot of swelling here, it's going to be hard to bend that knee.
Right.
You know, you may have talked to your friends or family that have had this in the past, and they'll always talk about how hard this is to bend. It's going to be okay. We'll get it there, okay? The faster we can get swelling out of this, the faster you'll get your range of motion back.
Okay.
Okay? Eventually you'll be able to keep this leg completely flat, okay? And then you'll be able to raise up. So you'll just be able to raise that leg up about here. Can you do that now? Can you raise that leg straight up? Not so bad. A little bit of pain. Okay, that's okay. Hopefully by the end of all this you'll be good to go with it.
Right.
Okay? The other thing I will have you do, you know, I will definitely help you with a lot of hands-on things after this. So, you know, the more you can relax and let me get comfortable with you, yeah, I'll be able to move your leg a little bit easier for you. That'll take some of the workload off of what you're doing. I will definitely have you doing things at home to try to speed up the process a little bit. But for the most part, the first few times I see you, we do a lot of hands-on, a lot of massage type things, trying to get the swelling out and trying to get your leg moving again. Once you progress, we turn it into more active therapy, where you'll be doing a lot more work than I will be doing.
Right.
But at the beginning, I do try to take care of you.
Okay.
Okay? So we went over, you know, the what to expect after the surgery part of this, you know, at least initially, okay? Your progression is going to be based on how well you do, how well the surgery goes. There's a lot of other factors that we look at here. I think this is good timing for you, okay? You've still got good range of motion. You're not using a walker or a cane at this point. So that's all in your favor to a little bit faster recovery than others, okay?
Great.
I will talk a little bit, while you're in the hospital, you will have a walker, at least initially, okay? They'll show you how to use that in the hospital a lot more than I will here today. I'll give you some instructions on that. You'll find that in the packet I give you, okay? It'll show you the basics of how to use it, but they'll also, they'll go over that with you. They'll talk about how to get in and out of your house. You know, they'll ask you questions about how your home's set up, how to get in and out of the bathtub, those sort of things. Okay? And then normally you have that for about a week, give or take. If you're doing well, less. If you're struggling a little bit, more. Okay? But normally you have that walker for about a week. After a week's time, I start working you towards a cane. We'll work on that in the clinic.
Okay.
You'll be able to do that more and more with me. And then I'll gradually have you start doing that independently at home. And then usually in another week to 2 weeks, you're done with any kind of assisted device. So no walker, no cane, and you're back to normal walking.
2 weeks.
if everything goes smoothly.
Wow,
Okay?
that's great.
Everyone's different.
Sure.
I can't predict that for sure. I can't give you a definite answer on it. But normally within 2 or 3 weeks time, you're feeling pretty good. Okay. And if everything goes the way I expect it to for you, I think we'll be there.
Okay. How many weeks before I can, let's say, go upstairs?
Yeah, initially we'll have you do one step at a time. Okay. The monogram they use is good leg goes up, bad leg goes down type thing.
Okay.
Okay. You'll figure that out quick. You take one bad step and you know it.
Okay.
Right? So the non-surgical leg will be your good leg for a little bit. That leg will go up. The bad leg, your right leg, will lead you down the stairs. Okay. Again, they're going to go over that with you in the hospital to make sure you're safe getting in and out of your house.
Okay.
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 Normally, by the time you hit 4 weeks, we've really cut down on how often I see you. May only be once a week at that point. Okay. The more you're able to do at home, the faster you're going to recover. And then by 6 weeks, I'm normally done with you. May see you once every other week or once a week just to make sure you're getting back to everything that you want to do.
Okay.
And at that point, you're also going to follow up with your surgeon who's going to go over anything that you still have questions about, or when you can golf or play tennis or those sort of things.
Okay.
We do limit how much you do that, but we want you to get back to doing everything that you want to be able to do. So,
Okay.
okay?
About how many weeks before I can drive?
So because you're having your right knee done, you're looking at probably 4 weeks. You know, if you ask me for my protocol, it's going to tell you 4 weeks. But if you're doing well, you have good control of that leg, you're off the pain medications, I'll have you start driving in about 3 weeks.
Wow.
Every now and then someone's a little sooner, but normally I'll tell you 4 weeks now, just so if you're ahead of schedule, then you're happy for that.
Okay.
Okay?
That sounds good.
I think we went over most of everything. The packet I'm going to give you has everything in it that we talked about. Okay, so if you have questions, you get home. I know it's kind of a whirlwind for you, but you can look through here. If you still have questions, you can always contact me. Okay, I'm here to help you try to get through this process as smoothly as we can. Okay, we've got a pretty good system down at this point, so as long as there's no major complications, everything should just kind of follow in line. Just kind of stick with the program.
Okay.
You'll also find the exercises that we went over here too. There's a couple of recommendations I made based on what I see with your leg now that you can do ahead of time. Those exercises will help you get ready for the surgery. And then there's also the exercises that you're going to do right out of the gate.
Okay.
Okay? If you're prepared for those ahead of time, if you've practiced them a little bit, they're going to come that much easier for you after the surgery.
Okay. About how many times a day am I doing exercise on my own?
Yeah, we try to recommend you twice. That is totally dependent upon how you're doing, how much swelling you have, how much you can tolerate. Your pain's different for everyone, so that's going to be dependent on you. But the papers I'm going to give you here are going to tell you that we want you doing these exercises twice a week, or twice a day, I'm sorry.
Twice a day, okay.
Okay,
Sounds good.
good. Any other questions at this point for me?
No, I think you explained everything very well. Thank you.
Good. So hopefully everything goes smooth for you. I'll see you back here just a few days after your surgery.
Okay.
So hopefully everything's smooth sailing. 4 to 6 weeks time, you'll be thinking that I didn't even need to have this, hopefully.
Wow.
So you'll be ready to go.
Okay. Thank you very much for your help. I appreciate it.